After looking at my Tallyval comments, it looks like I've been doing a pretty good job on the medical history portion. One of my patients had an elevated blood pressure reading, so I alerted my instructor and I took it again after waiting 5 minutes. His blood pressure was still high, but not high enough to where we couldn't treat him. One of my other patients was a type 1 diabetic, and I was able to complete my medical history comp on her, and it went really well. I've really only had 3 patient sessions so far this semester, just due to the way the schedule was, and they were all initial appointments, so I haven't really gotten into a lot of calculus charting, and I haven't started scaling yet. I've taken 1 set of bite wings so far. I plan on taking a full mouth series this week and possibly a pan. I've really been trying to practice my probing this semester. I feel a lot better about it than I did. I just need to remember to keep the probe parallel the whole way until I reach the contact area. I also need to make sure I'm not over or under angulating. I have an adult and adolescent patient to complete, but I still need to find a child. I want to work on improving on my time management. I'm hoping to be able to use the slimlines this week and practice with those. I hope that maybe 2 of the patients I see this week will end up being in calculus class 3. I'm starting to feel more confident completing the IOEO. Obviously, I haven't learned about all the lesions yet, but I've started to notice lesions from chapped lips, Fordyce granules, and different things. As soon as I get to the point of polishing, I'll probably do my polishing comp. I just haven't reached that point yet. After I start scaling a time or 2, I'll get formative feedback and practice with the feedback before completing the CDNR. When instrumenting, I just really need to focus on keeping my fingers in contact and making sure my thumb stays bent. I want to be sure to close the blade towards the tooth once I make it around to the mesial. I want to continue to practice my indirect vision and become really comfortable with it. I know I've gotten a lot better, but there's still room for improvement. I really want to just focus on finding patients and meeting all my requirements for the semester. I was a clinic assistant last Wednesday, and I put instruments away, stocked, helped a student probe, seated patients, and wrapped cassettes. This is a very busy semester, but I plan on managing my time just a little better to be less stressed and get more done. I'm hoping to get good feedback and get lots of good practice in.